are some of the things that I wish I had known before going into surgery. Hi, I'm Antara and I recently had surgery. So I'm somebody who doesn't really have a medical history. So before going into surgery, I wish there were a lot of things that, I had known about. I had done a lot of research, but there were still a lot of things I felt that are quite common, but we don't really know about them. So here are some of the things that I wish I had known before going into surgery. So point one is to find a doctor who is not going to say that, oh, you'll be okay in 2 days, oh, you'll be back at work by next week. No matter how big or small your surgery is, at the end of the day, it is a surgery. Find a doctor who's going to tell you that it is going to take time for your body to recover. So give it that time. My doctor was very clear. He said for the first 7 to 10 days that I am to do absolutely nothing. So my only job was to get pampered by my family and friends. So he said that even if you're feeling okay, even if you're not in pain, you just need to be in total rest. Before surgery, there are a lot of tests that are done. I was not aware of that. So they will have like blood tests where they're going to take a lot of blood. I mean, they took large vials of blood. There'll be x-rays, urine tests, ECGs, and something called as the pre-anesthesia check. So a lot of people assume that that would mean that, that they would give you a little bit of anesthesia to check, but that's not what it is. It is like an interview session, a question and answer session, where they will be asking you about your medication, about allergies, about supplements. They will check your blood pressure. So this happens about 2-3 days before your actual surgery. And I found that that was a good time to ask personal grooming questions like, can I get my, eyebrows threaded, or can I get my nails done? If you have questions like that, I felt this was a good time to ask. Oh yeah, so now we will go to the day of surgery. So once I went like around 7:30 to the hospital and I was made to wait. So they will, an attendant will come and she or he, depending on your gender, will shave you. So they will shave your private parts and most likely they will trim your nails. Of course, this may differ surgery to surgery. For mine, which was a gallbladder removal, they shaved me. So they shaved my private parts. That is something that you should be prepared for because you might feel uncomfortable thinking about it. But honestly, in the hospital, once you're there, you realize you're the patient, you realize, all the staff is there to help you out. It felt quite, I felt totally comfortable and okay with it. I didn't feel awkward about it. I didn't feel uncomfortable about it. But what you probably don't know is that your surgery can get delayed. So mine got delayed by like 5-6 hours. According to my calculations, I was supposed to be without food and water for maybe 15 to 20 hours. That turned into 24 hours without water and 36 hours without food. So surgery can get delayed, and not by half an hour. It can get delayed by half a day. You might have to interact with other patients, and that might not always be a very calming experience. Outside of the operation theater is a big room where there are lots of patients who are waiting to get surgery done. So I had a patient next to me, an auntie. She also had to get her gallbladder removed. This auntie was totally freaking out. When will the surgery be? I haven't had water from 5 in the morning. Take off this blood pressure machine. And she was just so agitated. So for the first half an hour, I was trying to, calm her down. But after half an hour, I realized that no, I can't do this because I am a patient too. I am also going into surgery. Taking care of another patient is not my responsibility. So I decided that now I need to focus on myself. I need to calm down. I need to take deep breaths and get my focus on myself. Another thing is, I don't want to scare you, but there are little things that can go wrong. So for me, it was the cannula insertion. So that big needle that they put in and then they put your IV through it. So there was like a really, I think, new nurse who had been there for only 1 or 2 days. And on my left hand, she tried to put in the cannula and she completely messed it up. It was just a disaster. And she then pulled it out and put it on my right hand. By then, I have not had food and water for 15 to 20 hours already. I was feeling weak. my left hand was injured. So I started feeling like I was going to faint. So I told her that I think I'm feeling dizzy. And she was like, lie down, lie down. And I did. I took deep breaths and I was okay. And then I got up and I realized that my left hand was a complete disaster. I could see my left hand like a bump rising, like it literally was rising in front of my eyes, and there was blood coming out of it. So it's like a volcanic eruption. Okay, something can go slightly wrong, but you need to advocate for yourself. So this is the next point, advocating for yourself. So I realized that something was majorly wrong here. I immediately started asking for a senior nurse. So I saw a senior nurse and I was like, excuse me, sister, excuse me, nurse, I need help. And so she came over and I told her like, look, I need you to do something here. As the senior nurse cleaned the blood off the wound, she pressed down on the bump and, helped me through it. So the thing is that first is that if things go wrong, you need to also advocate for yourself. And that has to be in every step throughout your hospital stay. One major thing the hospital messed up was that they took me inside 2 o'clock, like I said, in the waiting area outside of the OT. Your family is not allowed there. At this hospital, what they did not inform my family is that my surgery had not started at 2:30. My surgery started somewhere around 4:30. But they kept telling my family, who was waiting outside, that my surgery is at 2:30. So every time anybody was coming out of that room and my parents, my husband were asking, they said, oh yeah, she's in surgery. Antara Sarkar, she's in surgery. Whereas I wasn't in surgery. So, ideally if I was in surgery at 2:30, I should have been out by say around 4ish. I came out after 6. I came out at like 6:30. So my parents, my kids, my husband, everybody just completely freaked out because they thought, a surgery which would have gone on for maybe 1.5, 2 hours had now stretched on for 4.5 hours. So it was a complete mess up on the part of the hospital. And again, this is something that can happen. I'm not saying it will, but please inform your family that something like this can happen, so they actually find out if you as a patient are in waiting or has your surgery actually started. And so the lack of information or misinformation can really cause a lot of distress to the families. Oh yeah. Then anesthesia. So finally my surgery started. I went in and they were going to put that mask, they put whatever injections and lots of things on the body, and then they said, this is going to be an anesthesia mask. In the movies, they show that they're counting down 10, 9, 8, or they're going to, tell a story and then you fall asleep. Nothing like that happened for me. I mean, they put the mask and I was out. So I was gone. So that happened with me. And then I woke up after surgery and I remember getting up and I was quite alert. So I remember asking that. I woke up and I was like, so is it done? Is it done? And they're like, yeah, it's done. And then they kind of rolled me out on the bed to go, meet my family. I am so shocked that people are not informed of this. Patients are not told that this can happen. Is that your body can shiver like crazy post-surgery, like out of control. You will be freezing cold and you will be trembling like that bad. The only reason I knew about it is because my cousin had surgery a couple of weeks back and my father had gone to meet her and she was shivering. So my dad in a casual conversation had mentioned that to me. This shivering was completely out of control, but because I had heard that story about my cousin, I realized it was normal. After surgery, they'll let you meet your family and then they take you away for 1.5 hours in recovery. So I was in recovery and I was like, I am freezing, I need another blanket. So they gave me a second blanket. I was still freezing. Then I asked for a third blanket. Again, advocating for myself. I was uncomfortable, I was feeling so cold and I was asking for what I needed. Finally, they had this big heater with they have this big pipe that they put inside the blanket and there's a heater. So that warm air enters the blanket. And then I looked around and I realized almost every single patient had that heater, which means that after almost every type of surgery, this is what patients face, that they feel super cold because your body has gone through trauma and because of anesthesia. So it's probably a combination of these two things. And then you're shivering out of control. So this is something you really should know and not be nervous by it. And please ask for a heater, ask for blankets because you will need it. You just had surgery, your body is in trauma, it needs to be taken care of. So shivering, oh, it's bad, but now that you know, you'll be mentally prepared for it. For gallbladder surgery, I can't speak for others. I realized that after surgery, 4 hours, the next 4 hours are quite unpleasant. You will feel discomfort. I don't really know how to describe it. It just feels really, I don't know, just weird. Okay. So if you can get through those 4 hours, if you can just keep breathing, keep your calm, you will be okay. So remember, you're still without water, you're still without food, but even then you have to keep your calm and know that, okay, the main part is done. It's now just the last bit where you have to kind of wait it out. By the time I was feeling better, it was like 11 p.m. because my surgery was in the evening. My primary caregiver was my husband. With me, my primary caregiver was also awake from 5 in the morning because my surgery was scheduled at 11 a.m. So from 5 a.m., the both of us have been up, and he has been running around throughout the hospital, up and down, between buildings, between wings, non-stop. So you have to realize that though you're the patient, the caregiver also needs rest. So when I was feeling, up and awake at 11 p.m., by that time, he was, of course, extremely tired. So I told him to order something good to eat, fancy food to eat, so that he feels energized, feels better. And he's like, I feel so bad. And it's like, no, you need to take care of yourself. Just because I'm not eating doesn't mean you can't. You need to eat something good to keep your spirits up. And so he had a wonderful meal. So keep that in mind as well. Your caregiver will also need some care. Now, after surgery, I was told that I could either use a catheter or try and go to the toilet. I chose to go to the toilet, but don't be a hero. If you feel like you can't do it, get the catheter. I felt like I could, but there was absolutely no way I could do it alone. I needed help. So I had an attendant and I had my husband Anurup. Both of them, helped me up. And then the attendant took me, and I needed help sitting down on the toilet. I needed help with my pajamas, tying the pajamas and getting up because I couldn't put any strain on my abdomen. You can't have any shame, okay? So you cannot be ashamed to ask for help. You cannot be ashamed of being naked in front of a stranger. These are things that you will need help with, and you have to accept that, and you have to ask for help, okay? Finally, my first sip of water came after 24 hours, so it came around midnight. So the last water I had was the previous night at between 11 and 12, and the next water I had was exactly 24 hours later. Again, after surgery, you can't just gulp down water. You can only have a few sips at a time, because if you gulp down water, probably because of the anesthesia, it can make you really nauseous and it can make you vomit. There are incisions in your body, cuts and stitches and staples. So imagine if you had to vomit, it would put strain and stress, and it'll pull your muscles and your incisions and your tissues, and that is something you definitely do not want. So even though it'll be hard, you have to have just a little bit of water, not too much. My meal came the next morning, so it was like 36 hours later where I actually had my first solid food. I was without food and water for much longer than I had anticipated. I was okay because I was mentally telling myself that there is literally nothing I can do. I needed to be mentally strong, which I was. I was taking deep breaths. I was chanting when I needed to. I was closing my eyes and resting. So if you are mentally prepared, mentally strong, your body will go with it. I mean, it's actually the needs of the body will not bother you, because mentally you're ready for this. Mentally you know that, okay, no water, no food, I can't do anything about it. This is my situation. I got to live through it. And therefore, your body will then support that. Okay? So the first couple of days, when you sit down to pee, it's going to take quite a while for the pee to come out. It's quite slow, so you have to sit for a minute and then you will start peeing. And the pressure with which it comes out, your urine, it's going to be very slow, because I think it's because of the anesthesia, because it's still in your body. It takes a couple of days for the anesthesia to leave your body. There's really, again, nothing you can do about it. That's fine, but I'm just letting you know it's nothing to worry about. I'm being very open and direct, but this is the point. I mean, that's why I'm making this. How you handle a surgery day is on your mental strength. So people will talk about how, what the physical discomforts you will feel. People will talk about how stressed you might feel. Yes, but all of that boils down to you being stable, being calm, telling yourself that whatever is happening, it's for the best. So even when my surgery was getting delayed, hour after hour after hour, I just kept telling myself that the universe has decided on a time for me, and my surgery is going to happen at that time, and it is going to be perfect. And that is exactly what happened. My surgery was perfect. It was really good. My recovery has been great, in fact. So these are some of my experiences and points. I hope you found them helpful. And watch for part 2, which talks about the day after surgery and recovery for the next 2-3 months. What happens with your body, with everything, what to expect in the coming months. Things that I wish I knew before going into surgery. Bye.